Your blood pressure is 180 over 100. Those numbers may sound familiar. Maybe you heard them during a routine checkup. Maybe you saw them flash on a pharmacy machine and assumed it was stress. Or maybe your body has already been trying to warn you. Through headaches, blurry vision, dizziness, chest pressure, or exhaustion, you keep blaming on age. What I'm about to tell you might surprise you. Many people walk around for years with dangerously high blood pressure and feel completely normal. Until the day something changes forever. Before we continue, take a moment to like this video and subscribe. I share these medically grounded health guides because small changes made early can sometimes prevent very serious outcomes later. Now listen carefully. A blood pressure reading of 180 over 100 is not something your body simply gets used to. It means your heart and blood vessels are under intense strain. Think about a garden hose with water forced through it at maximum pressure all day long. Over time, the hose weakens. Tiny cracks form. The same thing can happen inside the body. Most people don't realize high blood pressure often damages the body silently. While you're working, driving, cooking dinner, or trying to sleep, your arteries may already be stiffening. Your heart may already be enlarging from overwork. Your kidneys, eyes, and brain may already be affected without obvious symptoms. And here's what concerns me most. Many adults wait for a dramatic warning sign before taking action. They assume if they're not collapsing, they must be okay. But I've seen this happen too many times. Someone ignores severe readings for months because they feel fine, only to later experience a stroke, heart failure, or kidney complications that could have been reduced with earlier intervention. That doesn't mean panic. It means awareness. If your blood pressure is this high, the first thing you should do is stop dismissing it. Recheck it properly after sitting quietly for 5 minutes. Avoid caffeine, smoking, or intense activity beforehand. If the reading stays severely elevated, especially with chest pain, weakness, confusion, trouble breathing, or vision changes, seek urgent medical care immediately. But even beyond emergencies, there's another truth many people never hear. Blood pressure is not only about salt. It's connected to sleep, stress hormones, weight, blood sugar, inactivity, alcohol, medications, and even chronic dehydration. Sometimes the body has been struggling for years before the numbers finally appear on a screen. And once those numbers rise high enough, the risk begins climbing quietly in the background every single day. That's why this conversation matters more than most people think. Now, I want you to imagine something for a moment. You wake up in the morning and everything feels normal. You drink your tea or coffee, check your phone, maybe rush into your daily routine. But inside your body, something very different is happening quietly. At a blood pressure level like 180 over 100, your arteries are constantly under force. The inner lining of those blood vessels is being stressed again and again, like a pipe under too much pressure for too long. Over time, that pressure can contribute to tiny injuries inside the vessel walls. And here is what most people don't realize. The body tries to repair those tiny injuries, but in doing so, it can sometimes cause thickening and narrowing of the arteries. This makes it even harder for blood to flow smoothly. So the heart works harder. The cycle continues. And many people never feel this happening until a major event forces them to notice. I've seen patients come in saying, "Doctor, I didn't feel anything serious. Just a little tired, a bit of headache here and there." But when we check deeper, we find that the body has been under strain for a long time. That's why high blood pressure is often called a silent risk factor. Not because it is harmless, but because it rarely announces itself loudly in the beginning. You might notice subtle signs and dismiss them. A heaviness in the chest after climbing stairs, slight shortness of breath, morning headaches that you think are from poor sleep, a feeling of pressure behind the eyes, even a sense of fatigue that you explain away as aging. But when these signs appear together, they may be telling a bigger story. Now, I want to be very clear here. Not every headache or tired day means something dangerous is happening. But when blood pressure is consistently very high, these signals should never be ignored or brushed aside. Another important factor is time. High blood pressure doesn't usually damage the body in a single day. It's the repeated exposure over weeks, months, and years that slowly increases risk. That's why many people are surprised when a sudden event happens seemingly out of nowhere. In reality, the process has often been building quietly for a long time. There is also an emotional side to this that I see very often. Stress, unresolved worry, and lack of rest can keep the body in a constant alert mode. When this becomes chronic, it can influence blood pressure regulation in ways people don't expect. So if you are hearing this and thinking, could this be happening to me? That question itself is important, because awareness is the first step in protecting your long-term health. Let me ask you something very honestly. Have you ever measured your blood pressure and immediately hoped the number was lower than last time, almost holding your breath before seeing it? That feeling is more common than people admit. When readings start reaching 180 over 100, the body is no longer just a little stressed. It is operating under a level of pressure that increases the risk of serious complications over time if it continues unmanaged. Now, I want to explain this in a way that makes sense without fear, just clarity. Your heart is a muscle. It works every second of your life without rest. Every beat pushes blood through a vast network of vessels that reach every organ: your brain, kidneys, eyes, and even your smallest tissues. When blood pressure is elevated, every one of those beats requires more force than normal. Over time, this can contribute to the heart muscle becoming thicker. At first, that might sound like strength, but in reality, it can make the heart less efficient. Most people don't realize this shift happens gradually, not suddenly. You may still be able to walk, work, and go about your day. That is exactly why it often goes unnoticed. The body is incredibly adaptable. It compensates quietly, but compensation is not the same as safety. I've seen individuals who were active, smiling, and fully functional in their daily lives, yet their cardiovascular system was under significant strain for years without their awareness. Another important connection is the brain. When blood pressure is consistently high, the delicate vessels in the brain are also exposed to increased stress. Over time, this can be linked with higher risk of cognitive changes, memory issues, or sudden neurological events in severe cases. This is not meant to alarm you. It is meant to help you understand why doctors take these numbers seriously, even when symptoms feel mild. Now, here is something very practical I want you to understand. A single reading is not always the full picture. Blood pressure can fluctuate based on stress, pain, activity, caffeine, or even anxiety during measurement. That is why proper technique and repeated readings are important. Sit quietly, rest for at least 5 minutes, keep your feet flat on the ground, and take multiple readings at different times of the day. But if your readings repeatedly stay in the severe range, like 180 over 100, that is not something to simply monitor later. It is a signal that your cardiovascular system needs attention and evaluation. And the earlier this awareness happens, the more options you have to protect your long-term health in a safe and controlled way. One of the most important things I tell my patients is this: blood pressure does not rise in isolation. It is rarely just one cause. It is usually a combination of daily habits, internal health changes, and long-term strain that builds quietly over time. And when I see a reading like 180 over 100, I don't just think about the number. I think about the lifestyle and body signals that may have led there. Let's talk about something very common: chronic stress. Not the kind of stress you feel for a few minutes, but the kind that stays in your body all day. Worry about finances, family responsibilities, work pressure, lack of rest. These don't just affect your mind, They activate hormones that can keep your cardiovascular system in a heightened state for long periods. Over time, this can influence blood pressure regulation in ways many people don't connect to stress at all. Another major factor is sleep. I've seen so many adults underestimate this. Poor sleep quality, sleep apnea, or simply not getting enough rest can significantly affect blood pressure control. When the body doesn't fully recover at night, it enters the next day already under strain. And then there is diet. Now, I want to be careful here because this is often misunderstood. It is not only about salt. Yes, sodium plays a role, but the bigger picture includes processed foods, low potassium intake, excess sugar, and overall nutritional imbalance. Many packaged foods contain hidden sodium that people don't even realize they are consuming. But I also want to emphasize something important. You don't reach a high blood pressure level overnight because of one meal or one day of eating. This is usually a long-term pattern. Physical inactivity is another silent contributor. When the body is not moving regularly, blood vessels can become less flexible over time. Regular movement supports better circulation and vascular health. And then there are medical factors. Conditions like insulin resistance, diabetes, kidney issues, and hormonal imbalances can all play a role in increasing blood pressure risk. That's why it's important not to assume the cause is always simple or obvious. What I want you to understand is this. When blood pressure reaches a level like 180/100, your body is not failing suddenly. It is responding to a long pattern of internal and external stressors that have likely been building for some time. This is actually good news because it means there are multiple areas where improvement may help support better control over time. And the most powerful step always starts with awareness, recognizing that your daily habits and health signals are connected more deeply than most people realize. Now I want to address something I often hear in clinic, and maybe you've thought this yourself too. I feel fine, so how bad can it really be? This is one of the most dangerous assumptions when it comes to high blood pressure, because the absence of symptoms does not always mean the absence of risk. At a level like 180/100, the body can still function, still move, still perform daily tasks. But internally, pressure is being placed on delicate systems that were never designed to handle that level consistently. What makes this even more concerning is how adaptable the human body is. It compensates, it adjusts, it gets used to higher pressure in a way that tricks the mind into thinking everything is okay. But adaptation is not the same as protection. I've seen people delay care because they didn't feel sick enough, only to later discover complications that could have been reduced with earlier attention. That is why doctors focus so much on numbers. They reveal what symptoms sometimes hide. Now let's talk about something very practical that can happen in daily life. Some people experience sudden episodes where blood pressure spikes even higher than usual. This can be triggered by stress, missed medications, pain, or even intense emotional moments. During these spikes, symptoms like severe headache, chest tightness, dizziness, or shortness of breath may appear. These moments should never be ignored, not because panic is helpful, but because the body is signaling overload. Another important point is medication. If someone has already been prescribed blood pressure medication, consistency is critical. One of the most common issues I see is people stopping medication when they feel better, assuming the problem has resolved. But blood pressure often returns quietly when treatment is interrupted. That said, medication is only one part of the picture. Lifestyle support remains essential in long-term management. Gentle daily movement, balanced nutrition, stress reduction, and proper sleep all work together to support healthier blood pressure levels over time. And here is something I want you to remember very clearly. The goal is not perfection. The goal is stability. Small, consistent improvements can make a meaningful difference in how the cardiovascular system functions over time. Even something as simple as reducing processed food, walking daily, or improving sleep quality can support your body more than most people realize. But the first step is always the same: taking your readings seriously enough to act on them, not ignore them. At this point, I want to bring your attention to something very real that often gets overlooked until it becomes urgent. Blood pressure at 180/100 is not just a number problem. It is a vascular stress problem. And when that stress continues, the organs that depend on steady blood flow begin to feel it in different ways. Let's start with the kidneys. Your kidneys filter your blood constantly every single minute of the day. They rely on stable pressure to do that job properly. When blood pressure stays high, it can gradually affect the tiny filtering units inside them. The concerning part is that early changes are often silent. No pain, no clear warning, just slow, progressive strain. Then there are the eyes. The small blood vessels in the eyes are extremely delicate. Persistent high pressure can affect them over time, sometimes leading to vision changes that people don't immediately connect with blood pressure. And then, perhaps most importantly, the brain. When blood pressure is very high, especially if it fluctuates or spikes, it can affect how well blood is delivered to the brain's tissues. Some people notice subtle signs, like difficulty concentrating, feeling mentally foggy, or unusual fatigue. These symptoms are often dismissed as stress or aging, but they can sometimes be connected to underlying vascular strain. I want to be very careful here. This is not about creating fear. This is about understanding connection. Because when people understand what is happening inside the body, they are far more likely to take protective action early. Now, here is something I tell my patients very often. The body rarely breaks suddenly without warning. It usually sends signals, but they are easy to ignore because they don't always feel dramatic. A little dizziness here, a bit of pressure there, occasional headaches, short bursts of breathlessness. Individually, they seem small. Together, they tell a story. And when blood pressure is consistently high, that story becomes more important. What gives me hope in situations like this is that blood pressure is one of the most responsive health markers in the body. It can change with consistent care, monitoring, and medical guidance. But that only happens when it is taken seriously early enough. Many people wait for a perfect moment to start managing their health. The truth is, that moment usually never comes. Life stays busy, symptoms come and go, and time keeps moving. What matters is not waiting for certainty. It is responding to what your body is already showing you. And if you are hearing this and recognizing yourself in these patterns, that awareness alone is a powerful starting point. Now I want to speak to you very directly. If your blood pressure has ever reached 180/100, even once, your body has already given you a serious warning. Not a panic signal, but a clear invitation to pay attention before things progress further. And I want you to understand something very important here. This is not about fear. This is about timing. Because in cardiovascular health, timing changes everything. The earlier you identify patterns of high blood pressure, the more options you have to support your body safely and effectively. And that support is not limited to medication alone. It includes understanding your daily habits, your stress levels, your sleep, your movement, and even your emotional load. Most people don't realize how interconnected all of this is. For example, improving sleep quality can help stabilize hormone balance. Managing stress can support healthier vascular responses. Regular movement can improve circulation. And small dietary adjustments can support long-term heart and kidney health. But none of these steps matter if the first step is ignored. And that first step is awareness. Now, I want to address something gently but honestly. Many people delay action because they are afraid of what they might find out. They avoid checking their blood pressure regularly, or they only check it when they feel unwell. But high blood pressure often does not wait for symptoms to appear. It continues quietly, day by day, beat by beat. That is why routine monitoring is so important. It turns uncertainty into clarity, and clarity allows you and your doctor to make informed decisions instead of reactive ones. If you are already on treatment, consistency is key. If you are not, then this is the moment to start taking your readings seriously and discussing them with a healthcare professional. And please remember this: your goal is not to compare yourself to others. Your goal is to understand your own body's pattern over time. I've seen many patients improve their outcomes simply by becoming more consistent with monitoring and making gradual, sustainable lifestyle changes. Not overnight transformations, but steady progress. And that is what truly matters, because your heart is working for you every second of every day. It doesn't take breaks. It doesn't pause. It adapts quietly to everything you put it through. So the question becomes simple: what can you do today to support it better than yesterday? If this video helped you understand something about your health that you didn't know before, take it seriously, not with fear, but with responsibility, and share it with someone you care about. Because sometimes the most important health warnings are the ones we wish we had heard sooner.